if you have any questions, maybe we'll take a couple of questions. Mark is already ready. While he's taking it, please be ready there, Julianne.
Well, I'm originally from England. We have a Minister of Loneliness, so I became aware of that issue thanks to the appearance of his position. But my question is that many young people in the United States, where I am now, seem to be very aware of the need for social connection, but they're confused about the role of social media. Is it contributing, or, that's the big question going on in many high schools in the United States.
So are you asking me if
Yeah,
it is?
yeah.
So it's really interesting because I served on a National Academies committee that issued a report on this, and the data is very complex, as you can imagine, because of course it's a complex issue, and the way in which it has been studied has been studied in a variety of ways, because of course there are a variety of different tools, a variety of different ways in which you can use it, and so it doesn't necessarily come out with very simple kinds of conclusions. I think everyone wants to know, is it good or is it bad? Should we get rid of it entirely, or promote it entirely? And I don't think it's as simple as that. And one of the things that is really challenging is that most of our evidence is also very correlational. And so likely there may be some bidirectional kinds of effects. We don't, and the other challenge is that it's constantly evolving. And so it's very difficult for the science to maintain the same pace as the changes that are occurring. As Vish said, that in some cases it can be associated with benefits, particularly for among those who are marginalized or minoritized in some way, and that often this can be a lifeline for them in a way that they are not receiving the kinds of support that they may need in their own lives that they are able to receive online. But we also see evidence of at least some kinds of small effects in terms of its effects on some mental health outcomes, behavioral health outcomes. And while we have evidence that people are seeking it out for social connection, we don't have good evidence of the equivalency of that level of connection. And so it is challenging. But I think we also need to recognize that we're also now heading in a completely uncharted territory when we now face AI. And so in some ways, we can kind of keep focusing on social media, but we also need to evolve into the new kinds of technologies that will also be used for social purposes as well.
Yeah, fantastic. So we want to give opportunities to other people too, but I just want to say a couple of things. So Laura, Christian is here somewhere in the hallway. Peter and I, we held a meeting here in Lugano exactly on this topic, social media and ill-being and well-being, and we did the same thing in the US. So our papers and special issues will be coming out where we are synthesizing this literature, and I think you'll hear from Garth. I think I know whether you talk about it or not, who has been a leader in this, in a very interesting way, because he has a health background, but is also one of the leaders for the digital technology companies. So I think we will have a chance to talk more about this. Great question. Yes.
Thank you both for these great talks this morning. I really appreciated it. I have a question about the distinction between social connection and loneliness, specifically about the last slide, if social connection were a pill, if you were. And I wanted to go back to one of the statements you made. You can have a lack of social connection but not be loneliness. So you hear a lot about this loneliness epidemic, and I really wanted to better understand what's sort of more important. Is the pill really about social connection or about loneliness? Which one is a stronger determinant in terms of health outcomes?
So social connection is thought to be an umbrella term that includes a variety of ways in which we can connect. And loneliness is just one indicator among many indicators of lacking connection. And it's really interesting because, so for instance, in my meta-analyses, the protective effects of being socially connected were significantly stronger than the risks associated with loneliness. Interestingly, even across a variety of studies that just look at the distinction between isolation and loneliness, so objectively being isolated versus that subjective experience, loneliness seems to be more strongly associated with mental health outcomes, whereas isolation is a stronger predictor of physical health outcomes. Particularly, it's a much stronger predictor of survival or risk for mortality. And so in a way, we need to really, I think, broaden our perspective because so much focus has been on loneliness, and it makes sense because loneliness is that uncomfortable feeling. And if we think of it as something akin to pain, it helps us recognize when something's wrong, but we need to be very careful not to just mask that pain and not actually get at the root of the problem. And so we need to make sure that we objectively meet our social needs and not just only focus on making us feel better in the moment and not feel as lonely.
Great. So we'll take just one more question because I don't want to get into trouble with Dr. Sylvia here. So anyone from this side maybe? So I saw a hand. So.
Hi, thank you for this opportunity. In Switzerland, we have a wonderful school, which is called the Rudolf Steiner School, which help to build up the individuality. I agree with Vish. This is the basic of everything. We start from our individual aspect. But this school is not very popular in Switzerland. It was born in Switzerland. It's not popular anymore in Switzerland. And it helped to build the individuality within a community, within the community of the rest of the students. Do you see that at the worldwide level, the educational model are changing to support these necessities that we have?
To a certain extent, I see very promising kinds of efforts. Certainly the role of schools are incredibly important because it's not universal, but in many countries, there's opportunities for public education. And this is a really critical time in development. And so we have very good evidence that those early childhood experiences have profound impacts on later adulthood, on a variety of outcomes. And so those kinds of early interventions are going to be critically important, and that early social environment is critically important. And so we're seeing a lot of effort. So for instance, in the United States, where I come from, there's a lot of work on creating more school connectedness, either through curriculum or through learning, so more cooperative kinds of learning approaches. But then also we need to recognize that our schools are often opportunities to use those places as hubs for our communities as well. So to bring members of the community in a way that can socialize. So schools, I think, are a fantastic opportunity to really strengthen social connection more broadly, not only for students, but the broader community.
Right. And the issue would be, how do we envision schools in the 21st century, right? Going forward, we're already in 2024, in building those connections, providing life opportunities to every child. Right. So thank you so much. Thank you, Julianne. Thanks.
Thank you, Vish.
And I don't want to be between you and coffee. So please take a break and we'll come back shortly. Thanks.